I evaluate bleeding with sex in a few different ways. So, what do you need to know? Hi, I'm your local OBGYN. I love women and let's talk about it. So, I frequently have patients coming in and saying, when I have intercourse, there's a little or a lot, or sometimes some spotting that can occur. And it's really frustrating. Some people get embarrassed, some people worry that there's something majorly wrong. So, I kind of have to go through like the list of things that could be the problem. The first thing could be trauma, and I don't mean like that in a bad way, but people, the first time they have intercourse, could have a small cut, or even if it's not their first time, there could be a cut or a tear somewhere. The hymen is very vascular, so it can bleed a lot. People that have bleeding disorders where their platelets are low or they don't clot normally, also at a much higher chance of some sort of bleeding with just like normal touching, which other people don't get. Infections, especially certain STDs, can irritate the cervix and make it more irritable. And then there's like the issue where there's something abnormal on the cervix that's not necessarily always a bad thing, like a polyp from the cervix or something called an ectropium, which is this weird normal area of tissue on the cervix that's super duper sensitive. Malignancies are also a concern that you have to rule out. So if somebody with cervical cancer or uterine cancer or like some sort of HPV lesion inside of their vagina can have bleeding from this as well. The thing that I really kind of throw out there, and I generally always fingers crossed hope that this is not the case, but some women are harmed by their partners, and that can lead to bleeding with sex as well. So they may not overtly tell me that that's their problem, but during an exam, I can sometimes see trauma that is more of like a violent nature. But that's what I do when I'm trying to think through this process.